Parkinson's disease by Marianne Batres. What is Parkinson's disease? Parkinson's disease, or Parkinson disease, is a neurodegenerative disorder that mainly affects neurons that produce dopamine in a general area of the brain called the substantia nigra. Symptoms include, in most cases, Parkinson's victims develop symptoms over years. The symptoms come in slightly different orders, since the disease varies from case to case. Victims may suffer from tremors of the hands during rest, but other forms are possible. Slower movements, bradykinesia, limb rigidity, and gait, as well as balance problems. Cures and treatments. Currently, there is no cure for Parkinson's disease, but there are many treatments. Something that helps in most cases is lifestyle changes, such as physical therapy that focuses on balance and stretching. A speech therapist may be able to help with dysphagia. More treatments. Some medications that may help with some of the symptoms of Parkinson's are carbidopa, levodopa, a chemical that passes through your brain and is converted into dopamine. Carbidopa, levodopa infusion was recently approved by the FDA in 2005. This medication is administered as a gel directly into the small intestines. More treatments. Dopamine agonist. This medication is unlike levodopa because these do not change into dopamine, but instead mimic it, lasting longer, but also not as effective. MAO-B inhibitors. These medications do not produce dopamine or mimic it, but instead prolong its duration by helping prevent the breakdown of dopamine in the brain. Surgical procedure. The only surgical procedure available to help alleviate some of the symptoms of Parkinson's is deep brain stimulation. In this procedure, they implant electrodes into a specific part of your brain where they are connected to a generator implanted in your chest near your collarbone. Causes. The causes of Parkinson's disease is caused by a loss of nerve cells, dopaminergic cells, in the brain. These cells are responsible for producing dopamine, which is a neurotransmitter, and thus leads to the symptoms of not being able to control muscle movements at times. Who does it affect? Parkinson's can affect anyone with low dopamine levels, but certain things are linked to it, such as age, family history, jobs that have you come into contact with chemicals that are linked to Parkinson's, race, serious head injuries, and genders. typically males. We have reached the end of the presentation. Thank you.